Hello. Hello, good morning and good afternoon, everyone. My name is Rita Misal. I work with UNDP's Crisis Bureau, and I'm very pleased today to present to you a tool for assessing impacts of COVID-19. This is a tool that has been jointly developed by the UNDP, World Bank, and the European Union. And we are working together for a long time in the past decade, actually, in conducting joint assessments. And therefore, it is this COVID-19 just presented an opportunity for the partners who've been working together under tripartite declaration for post-crisis assessments and recovery planning to come together again to support national governments and work with the national governments to assess the impact, social and economic impacts of COVID-19. And so thank you very much for joining this session today. I will speak for a few minutes and then we will have question and answers. And I invite you all to send your question and answers by chat. So as I already mentioned to you that the CRNA or the COVID-19 recovery needs assessment is based on a long-term partnership with the World Bank, the European Union, and in countries where we have assessments, the other regional development bank all join the assessment. This is done together under the leadership of the national government. And the best part of this, the most important asset of this CRNA is that it brings together all the national and international partners together to do one assessment and support the national government rather than pitching out multiple assessments, reaching out to people separately. We have one joint assessment which comes up with the recovery plan. This assessment practice builds on something that we have done globally about in 70 countries plus. And since the COVID-19 has started, we've completed 4 such COVID-19 socioeconomic impact assessments. This has been in Azerbaijan, in South Africa, in Ecuador, El Salvador. Now we're working towards doing the same in Zambia and Eswatini. So what is it about the CRNA or the COVID-19 recovery needs assessment that is attracting government partners to doing this assessment? Number one, I think it is that it is a joint tool that aligns all development partners together to one recovery plan. The second, that it is very flexible in terms of the sectors to be assessed and the way and the timeline for the assessment. The third is that it is a very comprehensive assessment that addresses the needs of all the vulnerable groups, but also is sensitive to the conflict context if there is one in the country. And therefore, I think one of the selling points that we have seen is that it is this comprehensiveness, but also the quality of the assessment that brings together experts from all the agencies to reflect on the impacts, not only on all the sectors of the national economy, but also to look at the longer term goals such as the sustainable development goals or even the national development goals of the country. One of the key things in this assessment is that we start with the pandemic assessment from the duration of the lockdown and go on to the 18 months or even 3 years or 4 years, depending on what the timeline is deemed for recovery. The important part of this is that we fix a timeline, a goalpost to start on, because that tells us how is the economic losses estimated through COVID-19 and what will be the needs for recovery. The sectors that are assessed in COVID-19 are typically what the government sectors are. As you can see, the range of sectors that would cover most of them which have been affected very much by the COVID-19, which includes sectors like tourism, telecommunication, transport. But importantly, we look at social protection issues. We look at the impact of it on all the vulnerable groups. This includes people with disabilities, women, older persons, and perhaps refugees, migrants, and asylum seekers where they are. The key thing about the assessment methodology is it goes through a very logical step-by-step approach, which looks at what was the situation of a country or the context, the political economy of it as the COVID-19 hit it, the vulnerabilities that existed before, and then a comparison of what has changed in the pandemic, whether the vulnerability is higher or how it has affected each sector of the economy. And then we do it at 2 levels. One is at the sectoral level. Remember the sectors that I talked about earlier. But the next one is about at the higher level, what is the impact on the macroeconomy of the country and overall impact on these people groups that I was talking about. And one clear deliverable of the CRNA is that we come out with cost estimates for recovery needs over the next 6 to 18 or 24 months, depending on the discussion with the government. These are estimated needs for short, medium, and long term for each sector and for the overall recovery. And this is accompanied by a strategy that looks at how we can build and bounce back better, how we can do recovery much more sustainably, and while at the same time aiming that the national development goals are also achieved during this period. I already talked about the deliverables and partnerships against which we work. We have a number of tools and training and guidelines because it builds on the post-disaster needs assessment methodologies. These tools and guidelines are available in the links here that is provided in the PowerPoint presentation. They are all uploaded in the World Bank, the European Union, and UNDP websites. And you are free to join this online course and actually undertake it so that you have the technical capacity to support your government in doing a set of assessments if needed. I'll quickly move to an example of a recent COVID-19 recovery needs assessment that was conducted in Ecuador. In Ecuador, it was led by the Ministry of Planning. As mentioned earlier, all assessments are done by the leadership of the government, and an assessment is commissioned by the government to the UN, EU, or the World Bank. And this study, the COVID-19, looks at an assessment of the social, productive, and infrastructure sectors in 4 areas and it took us 3 months' time. The total economic losses for this particular COVID-19 impact in Ecuador was about $6.4 billion. And the estimated recovery needs is something like $2 billion over a period of 18 months, next 18 months. So this is a key result that we have been able to produce with the government from Ecuador. I just like to just share this quick result on who participated, and that's an important thing to see, to emphasize the point about that this participation is not about one agency leading it. It is a multi-stakeholder process in which the government leads. As you can see, the Ministry of Planning is leading it, and then you have the macroeconomic and the human impact led by various leads of UN agencies, the World Bank leading in the macroeconomic impact with the Ministry of Finance and the Central Bank of Ecuador. And then you have lead UN agencies who are technical leads or technical subject matter experts in their subject, such as UNICEF doing education and WHO leading in health. They are the ones who work in their particular sectors with the line ministries to come up with the assessment. The important point here is that this is one assessment. Everybody contributes to this one assessment, and everybody then finds resources and programming to take these recovery needs forward through this assessment. In Ecuador, the key result was how many people would actually become poor over the next 6 to 18 months due to the pandemic. This was the key result of the Ecuador income poverty details. Before the pandemic, about people were 4.3 million people lived below the poverty line, and after the pandemic, even in less than 3 months, about 6.4 million went into poverty. And this is a steep increase in the number of vulnerable people that must be planned and taken care of through employment and livelihood scheme, or either through employment and livelihoods or to social protection scheme, which was part of the planned recovery strategy. And one of the key emphasis of all the assessments that we have conducted so far is that women and girls are more affected than men. While we have seen that the data for mortality among men, fatalities among men due to COVID-19 is quite high, it's noted that even though women tend to be less affected, but they are more affected in terms of issues of domestic violence, which seem to have increased. In terms of access to their livelihoods, they are the ones who have been dropped out of jobs. They are the ones who work has increased because they become the caregivers when someone becomes sick. And in addition to that, all the regular health services that they would have access to, all these health services are no longer available to them. So the highest impact is on women and girls. And this study is not only done in Ecuador, but also has been done in Azerbaijan, in South Africa, in El Salvador as well. These points are proved over and over again that women seem to be more affected than anyone else in this particular pandemic. This is a quick picture of the consolidated loss and recovery needs that the assessment comes out with. Here you will see a range of sectors that we have covered in the assessment, which is all sectors of the economy, but also looking very closely at social protection issues in the first under social sectors. And then you see a total loss against each sector. About $6.4 billion the government has lost due to the extra efforts that they had to meet for the meet of the needs of the pandemic. And in that case, we would see that the public sector, because the service in the public sector is lower than the private sector seems to be more affected, which means that health services or education services are largely run by the private sector in Ecuador. Similar for all the commercial and industrial activities, you notice everything is private there. So the loss was incurred private industries, but also to households. That's what the assessment tells us, that 63% of the loss to the GDP was against these few productive sectors. And the recovery needs you would see against each sector, it comes to around $2.758 billion. So this is an example of what could be the result of an assessment. This provides numbers for each sectors with clear guidelines and recommendations as to what the sector should do in terms of recovery needs. When you see an amount here for in disaster risk management for $2.7 million, it means there are activities planned for implementation in supporting the recovery of this particular sector, the disaster risk management sectors, increasing the capacities, increasing tracking and tracing, supporting risk communication efforts. This is what is budgeted for when we say recovery needs. So I'd prefer to stop my presentation here. And if there are questions, I'll be happy to take them. Thank you very much. Thank you. I see a question related how the assessment has been adapted to COVID-19 crisis. What has changed? Two things has changed significantly. When we do a post-disaster needs assessment, we usually have something called post. That means our start time for the assessment of the impact is after the disaster. Whereas in COVID-19, what change we had to significantly make is to decide at what timeline we start to assess the impacts of COVID-19. I think the first thing that we decided is that in most countries, there has been issued a lockdown, a stay-in-home place, and where businesses slowly close, schools close, except for essential services like health, everything else closes. So this becomes the timeline for us to start the start of the lockdown period. For example, in South Africa, it was the 45-day duration of what they call level 5, and then coming down to level 4 months of March, April, May. 45 days of duration that we took as the lockdown period from when we had to do the assessment. That was the duration we decided on when we did the South Africa assessment. Thank you very much for putting up this slide. This is about South Africa, and in this assessment, we found out that 4 provinces were most hit by the pandemic. These are the poorest provinces, but also a location where poverty was already high. So it kind of also emphasizes the point that those who are more poor are most likely to be hit by the pandemic harder. And also the income inequality that existed before the pandemic becomes even higher after the pandemic. So I think these factors were brought into sharp contrast in South Africa, where income inequality and domestic violence is already very high. So thank you very much for that question. Thank you. I see a question about the partnership between the European Union, World Bank, and UNDP. What is the added value of this collaboration? It simply brings together the 3 largest UN agencies. I think I would like to make a correction. It's not UNDP, it's the UN system. So this is about at least 30 agencies of the UN system that align behind the national government. The World Bank, because it has the largest lending programs in many countries, and the European Union, which does funding a lot of the development programs. So with these three agencies was a decision during the Asian tsunami that instead of doing separate assessments, we would all come together and do one joint assessment. And I'm glad to say that this has worked extremely well. The partnership has worked extremely well, but because it reduced the transaction cost of the national government by doing only one single assessment. And it helped the government also to be in the leadership of selecting, working together with one system rather than with multiple assessment systems. The next question I see is which countries requested this assessment and how long does it take? Well, so far we've had requests from 8 or 9 countries. Azerbaijan, South Africa, I mentioned, Ecuador, El Salvador, Cape Verde, Eswatini, and Zambia. An assessment usually takes about between 2 months to 3 months, largely because it's a longer duration, largely because most of these assessments can be remote assessments. You're not allowed to go into the field. So we do have to give a little bit time for collecting information remotely, either through phone calls or surveys that can be done online. And therefore, it takes a little bit longer than we do in a typical post-disaster needs assessment. So thank you very much for that question. Thank you very much. Yes. Do you improve your tools based on feedback? We are just on the start of this process. We've just finished conducting 4 full assessments, but at this point of time, we are also commissioning a lessons learned of COVID-19 recovery needs assessment, just for us to be able to receive feedback on how we have applied it in countries and what could be improved further. We have a draft guidance note. It is a live document based on the lessons learned or this evaluation that will take place in the next following months and 2. We will be improving the guidance note so that then we have a final guidance note that can be used for all pandemics, not only COVID-19, but for all pandemics. Yes, so definitely this is something that is planned for. We also seem to have developed a set of training materials specifically for COVID-19 recovery needs assessment, and we'll be running a first training in West Africa for ECOWAS and SADC region, government officials of that particular region. So this is work in progress, and all of this is testing and piloting, and we will do it as soon as we have feedback from the training as well as from the lessons learned to improve both the guidance note as well as the training modules for CRNA. Thank you very much. There are 2 ways. We first rely on already collected data by the national government and each sector and national ministries. I am responding to the question related to the data assessment and how do we collect data. An important point here is that the government itself has already collected large volumes of data. Information is mostly available with them. However, we do try to reach out to various vulnerable groups or even small and medium term enterprises to find out what is the impact on their small businesses and informal workers. We try to do this by phone interviews. In South Africa, it was phone interviews. In Azerbaijan, we have done online interviews. We have actually given forms to small businesses, asked them to fill it online. So these are the various kinds of tools. People can use a Dropbox to come and fill in the form and give us back the information. So various kinds of tools have been used. And mostly it is secondary data used from the government. But when it comes to understanding the impacts on old people, people with disabilities, it has been primary data collection. And this has been through phone or through online platforms. Facebook has also been used for people to respond back with questionnaires that we have given to them. Thank you. Thank you very much for your time. I would encourage you to look online on the link that I have provided, the International Recovery Platform. The International Recovery Platform has a link to the COVID-19 guidance, the pandemic assessment guidance. It has a link to all the assessments that have been completed so far. So you can also see the assessments. If you would like to in any way learn more about this, please contact me. My name is Rita Misal, and my UN ID is rita.misal@undp.org. I'll repeat my email ID. It's rita.misal@undp.org. So I think that if you reach out to us, and then we will be able to respond to your questions individually. We can also, if there is an interest within the government, make a presentation on the tool, how it has worked, and perhaps then think about the application in your situation wherever you are. I would also like to add that this assessment is not only done by the three partners. Once again, I would like to emphasize it is open to all the regional development banks. It is open to civil society partners, because without them, our reach to vulnerable groups is very limited. And then it's also open to bilateral partners, the donors who are particularly in that country. So therefore, this we try and see as much as possible to be inclusive. The partnership is not exclusively to EU, World Bank, and the UN, but includes all the regional development banks. It includes all bilateral donors and civil society partners who make very key contributions to this particular assessment and informing on the impacts on various people's group. Thank you very much.